All right. Everybody coming up?
Should I sit on this side?
Either way, I'm a middle child. You can do whatever you want, and we're still going to keep coming back for more. Okay. Is everybody ready? We are going live now, and got to get my panelists coming up here as well. I'm Joe Hohenstein. I'm the state representative for House District 177, which is, hey, we've got some constituents. So one of the things I'm going to tell all of my constituents is after this panel or sometime during lunch, I want anyone who is a resident of the 177th to come up, and we're going to take a group photo. But I am going to be moderating this panel and also providing some of the updates on state legislation. But this panel is providing legislative and administrative policy updates on the federal level, the state level, and the city level. And for the federal level, we have Allison Hernandez, who is the policy advisor with the Senate Special Committee on Aging, which is chaired by Senator Robert Casey. We have Tawny Holmes Hillebach, who is special counsel in the White House on some disability issues. I don't know exactly your office, but you please let us know when you are here for that.
Will do.
What?
Will do.
Okay. And Adrian Moore is the executive director of the Philly Office for People with Disabilities, which, as we learned earlier this morning, is now an actual chartered office of city government and not just something that was created in the mayor's office. It went from that to now being a formal chartered structured office in the city government, and we're going to be talking about that as well. So I do want to start, I think, with Allison, with some of Senator Casey's initiatives coming on legislation, and then we'll go to Tawny to complete the federal picture before I come up for the state.
Hello. Good morning, everyone. I'm Allison Hernandez. I work for Senator Casey in Washington, D.C. I'm joined here with some of our outreach staff, also Tia, who's sitting in the audience. It's really good to be here and be part of this big event. As most of you know, Senator Casey is deeply committed to disability policy and has a long legislative history on various issues. A lot of that work comes out of the committee he chairs, so the Senate Special Committee on Aging. When we talk about the policy work he does through the committee, it's birth to death work on disability, so not just disability as it relates to aging, and that's an important differentiation for us when we're talking about the work that the committee puts out. So I'm here to talk or highlight a few of the sort of legacy issues that Senator Casey has been working on. I know some might be more relevant and top of mind than others, but I think they're important to touch on nonetheless. So to start off with, we have some of the work he's done on competitive integrative employment. That's an active issue in trying to work to eliminate sub-minimum wage work and make sure that everyone has an opportunity to work in the place they want, be supported with the technology they need, and earn competitive wages. That's been a place where he's done a lot of active work actually recently, and we're really hopeful that that's something that maybe this Congress we can still see pass in some way or at some level. So we're making really, really great progress. The other piece, or big piece, and very relevant to the upcoming time, is his work around voting access and also supporting people with disabilities to run for office, and be able to do that without it compromising any of the benefits they might be receiving. So Senator Casey has a suite of voting bills, some that work on the actual physical infrastructure of accessing voting, others to make sure that people with disabilities, and I see actually Neil here in the audience, can run for office and perform their duties with support and access to the technology and anything that they need. And then finally, like I said, making sure that campaigning and activities of that relevance aren't interfering with any benefit that someone is receiving. So three big bills, all very important and all very relevant. And then the last two initiatives that I think have been part of Senator Casey's legacy that are really important are his work around home and community-based services. He has introduced to date about 4 pieces of legislation that really work to bolster and support the workforce that we need to deliver those services, and also ensure that, you know, eventually we can get rid of waiting lists and make sure that everyone has entry to those services when they want and when they need them. Top of mind specifically is also the Home and Community Based Service Relief Act, which would extend the American Rescue Plan dollars that passed in the last couple of years. That's going to expire in March. So we'd really welcome a lot of advocacy around that and rallying to make sure that that money can continue. And lastly, I will mention Senator Casey's newer work around accessible housing, because we always talk about the H in HCBS, and he introduced this Congress a bill that would ensure that more affordable and accessible housing is built through the low-income housing tax credit program. So that's an overview of a lot of the work that he's been doing. Obviously, he has a lot more in his disability portfolio, and I'm happy to talk more in depth on any one of those bills.
Thank you. Tawny, would you please present the update from the administration on the federal level?
Absolutely. Thank you for the wonderful welcome. And Allison, thank you for sharing all that Senator Casey has been doing in Congress. It's really amazing to see what can happen. Sure, let's switch seats. It's really wonderful to know what is happening in Congress and the bills that are coming through. And then in the executive branch, we've been also rolling up our sleeves, doing some good work as well, working in tandem as much as possible with Congress. I am on the Domestic Policy Council, which means that we keep tabs on all of the activities happening in our administration and across all federal agencies. So when a bill is passed in Congress, oftentimes that is sent to a specific agency to be enacted. There are a number of great things that have happened in this administration. If I pull up my notes here. Employment has been a major focus, especially for people with disabilities in the Biden-Harris administration. We have seen that federal employees with disabilities and federal contractors are now earning $15 an hour as minimum wage. It's amazing as well to know that the employment rate for people with disabilities has gone up to 37.2%. That is the highest ever in recorded history, and that is across fields including construction, advanced manufacturing, and clean energy. So this is all very important and due to the BIL, the Bipartisan Infrastructure Law. Over $1 trillion has already been invested in improving and modernizing infrastructure across the United States, including roads, bridges, public transit, broadband internet access, water systems, and clean energy overall. And we know that a lot of funds have been spent in Pennsylvania and much more to come. It's really important to see these types of things happening because we need to have a strong infrastructure to continue to be able to travel safely, and that certainly includes people with disabilities, their caregivers, and support systems, and making sure that people can connect remotely as well through high-quality broadband access, and that has been a major focus of the administration. We want to reduce the digital divide. We know that there are people with disabilities in rural areas or in places where they haven't had affordable, accessible, high-speed internet, and that is now changing for the better. I can also say that when we talk about home and community-based services, HCBS, $37 billion has been invested in this area as well. And that includes the improvement of wages for direct care providers. We know that there is a shortage of folks who are working with people with disabilities, and we need to invest in that workforce so that people with disabilities can thrive and live independently in their communities. President Biden also signed an executive order to improve access to high-quality health care. And what that's meant is that over 50 agencies and decision-making bodies have been working to expand access to home-based community services and care. That includes veterans with disabilities as well. And we see that the Centers on Medicare and Medicaid, CMS, now have a final rule that was released to improve access to HCBS. I'd also like to add as well, as Allison mentioned, the ABLE Act is incredibly important. It's empowering people with disabilities to be able to have additional savings and assets without losing their benefits eligibility. People should be allowed to save, including people with disabilities, in order to plan for the future, and we're glad to see that that program is growing. Finally, last but not least, education. We must be investing in special education and making sure that all students with disabilities have equity in their educational experience. This administration has made a historic investment in investing $1.4 billion into IDEA, the Individuals with Disabilities Education Act. This work continues, along with encouraging Congress to give additional funding to special education to make sure students are prepared for the workforce in the future. And we recognize the importance of competitive integrative employment, and we recognize just how well that works. There's been a 20% increase of employment of people with disabilities since the beginning of the Biden-Harris administration. That's also resulted in increased wages and the ability for people with disabilities to be independent and productive citizens. Thank you.
Thank you. I'm just going to stand for where we are because we got to make sure we actually have some camera. But thank you for both of those updates. And I think it is really important that we recognize when we are talking about different changes that we're making in our laws and our policies. Oftentimes, what happens is those occur in an administrative context first, but that we in positions in the legislature have responsibilities to make sure that we're then codifying that in actual legislation and laws that will survive from one administration to the next. So I really applaud all of the work that the Biden and Harris administration are taking, and I have been a longtime fan of Senator Casey's work in our disability area, and the idea that the senator is there saying these are things we need to codify and change into law is really vital. So, so thank you. I'm going to give a briefer update on state issues. We have one very recent and very important development, which is the passage of Senate Bill 1274 in the Pennsylvania legislature, and it is now going to the governor for signature, and that will modernize Act 57, which is the act that addresses and regulates interpreters for the deaf and hard of hearing community. And that was something that was spearheaded and led by people within the deaf and hard of hearing community and the interpreting community. And this is one of the key features of what I think makes really good policy, which is we go to the communities that are impacted and we get their ideas, their thoughts on what makes the best policy. And that is something that was done in spades, and some of the folks who, yes, you can congratulate yourself there, Neil. What some of us here at this summit were part of both that crafting and also the lobbying on the law. And I think that, again, is one of the things that we've got to make sure that we're doing, is engaging and involving all of the different elements of the disability community in how we put legislation together. Another example where that happened recently is with a Capitol crawl. Who here remembers the big Capitol crawl that came before the ADA, right? That was a really huge event. What we did in May with Disability Pride and PA and a number of other advocacy organizations is had people crawling up the Pennsylvania steps. And if anybody's ever been to the Pennsylvania Capitol, it is, as Mark Twain once said, one of the most, if not, actually, Mark Twain said it was the most beautiful state building in the country. And it is. It's fantastic, it's wonderful, and it's inaccessible. It cannot be entered by more than one way by someone with mobility disabilities. It doesn't have any features to it that make it friendly in any way to people with sensory disabilities or other, other ways of walking through the world. So we held a Capitol crawl in early May, and I'm not going to take credit for it because I have a feeling he was already looking at it and putting some of this work together. But later in the summer, the governor announced that there is a task force that will now be examining the accessibility issues for the state capitol building and the facilities around it specifically. And I will say that if anyone wants to be engaged or connected to that investigative task force, because that's what they're doing, they're going around and asking, reach out to my office and we can make sure we put you in touch with the people from the agencies that are examining what accessibility will look like in our wonderful, beautiful, historic, but very hard to get to state capitol building. And then finally, I want to give an update on a piece of legislation that started with my first disability summit, which was in the beginning of 2020. And after that summit, I was approached by a constituent, Lisa Aquila, from a group called Disability Equality in Education. And Lisa laid out a plan and told me that I needed to be the person to help to pass disability inclusive curriculum. And with bipartisan support, I had a Republican colleague of mine, Jason Ortitai, from out in Allegheny County, who helped to champion the bill along with me. We passed that into law a few sessions ago, and just this budget season, we were able to secure a larger, more dedicated line of funding of $300,000 for that pilot program. So we are now about halfway through the 3 years, of that pilot program, and hopefully that will turn into a permanent program in the near future. There are some other things that we could also discuss, but we'll wait until we get to questions and answers. And before Adrian speaks, I will say this about any questions. I'm going to ask for people to bring them to me in written form so that I can read them here from the podium in order to make sure that we're able to get them directed to the right person on the panel as well. So any questions that people have, yeah, you can either bring them up to me or bring them up to my Chief of Staff, Tara, right here, and give them to her so that we can ask them. And with that, I'm going to turn it over to Adrian, who is our Executive Director for the City Office for People with Disabilities.
Thank you so much, Joe. It's a pleasure to be here today. I'm Adrienne Moore, the Executive Director for the Office for People with Disabilities. I have a background in architecture. I'm trained as an architect as well as city planning. I've always had a specialty in facilities management and ADA. I'm very passionate about the work that I do. One of the main focus features of our office is providing resources to residents on disabilities and trying to help them navigate some of the challenges of getting some of the support that they need for themselves or their families. Another aspect of our work is advocacy and policy change. And so last year in 2023, we actually collaborated with Councilmember Brooks' office, Kendra Brooks. And the reason was because when our office was created in 2017 by Mayor Jim Kenney, it was an executive order, which means that a future administration could just abandon the office potentially. We were very concerned about this and wanted to push to make our office a permanent part of the city legislature. And so connecting with Councilmember Brooks, she presented this to City Council last year. It was unanimously passed, which allowed this to become a question on the November 7th ballot last year. And Philadelphia residents voted on whether or not to make our office a permanent part of city charter. And so this just connects to what Representative Hohenstein says about codifying these ideas and making them law. And with the residents' votes, we had achieved our goal of becoming a permanent part of the city charter, part of the Philadelphia Home Rule. And we are officially now the Office for People with Disabilities. So we are still under the city. However, we are not just existing by an executive order. And so this is just an example of how important it is to not only be aware of what the city may offer in terms of disability services, but to also be aware of what happens behind the scenes. In addition to a lot of other achievements that we made last year, this was a priority. Last year, we published a map of disabilities for the city, which is available on our website. It provides demographic data of all of the people throughout the city by zip code or district that have various types of disabilities. And this information is from the American Community Survey or the U.S. Survey Census. We also did what is known as the ADA project last year, where we were able to install more than 600 accessible signs in City Hall that have raised tactile lettering with Braille. This was a huge achievement. Along with that, we also did a lot of ADA updates to our free libraries, as well as some of our Parks and Recs locations. So this was a really big initiative that our office undertook. But again, policy change is where a lot of our improvements begin. And so we can't just look at physical barriers or other barriers to access without looking at policy.
Thank you. And actually, I was told that since we don't have index cards or things that people can easily write on, that if you do have a question, raise your hand and Tara will come to you. But we do at least have one person with a question.
We did get one written question. With the passage, and this is for Rep. Hohenstein, with the passage of the ASL interpreter bill yesterday, you stated that this was a great starting point. What comes next, and what other changes do you have in mind in terms of proposing legislation?
Okay. Well, one aspect that we need to address is folks that are called certified deaf interpreters, or CDIs. And these are people from within the deaf community who are able to provide additional communication support when someone who is deaf is not fluent or capable of speaking effectively in American Sign Language. They may have a different sign language. They may not have been raised with sufficient language to be able to learn ASL effectively. So many of those folks need CDIs, or certified deaf interpreters. And we do need to sharpen up some of how we certify people who can work as CDIs. So that's one area where we can improve. Another area is that we simply need to make accessible and to connect and get and this is less of a legislative regulatory fix, but maybe what we need to do is have a legislative program that would establish a workforce development program for interpreters on all sets of the scale, on ASL, which are your hearing interpreters, and your CDIs, and supporting the educational programs that will provide those folks with the sets of skills to make them able to be certified and then work as interpreters. But right now, I can speak from personal experience, there is a shortage of skilled certified interpreters in the state of Pennsylvania. And one of the reasons for that is that we have not had a very strong or effective either registration system or continuing education program to develop that workforce. So those are things that I would work on.
And we have another question. This is for state and federal levels. What legislation is being worked on to secure rights to marriage that don't impact benefits?
Do you know?
Hello. Yeah. So there is active legislation. It's not led by Senator Casey, but that it's absolutely supported by him to make sure that people can marry, and that wouldn't affect their access to benefits or create a situation where it leads to having to be impoverished to the point where it doesn't make sense, right, to legally be married. So I'm happy to follow up in terms of the bill number, because I don't remember it from the top of my head, but that has been a top of mind issue in the disability policy world for a very long time, and one that's continued to be championed, and one that Senator Casey has always supported. So I don't know if you want to add on the state level.
I would add that this is something that is primarily a federal issue, but we do need to look at it on a federal level. We can also sometimes pass resolutions to give our federal legislative partners a nudge on this. I know I have seen this issue coming up in my neighborhoods, in my district, with people who effectively get penalized when they are married, because then their aggregate either benefits, or if one of them works, let's say one of them works as the caretaker for the other, then they often see income going above federal limits, and they effectively fall off of what we call a benefits cliff. So there's a penalty when those folks formalize their relationships with marriage sometimes, and that's something that we don't see in the what people would call the able-bodied population. We have a question over there.
And just to add really quickly, Representative Hohenstein is far too humble to tell you all today, but he actually introduced House Resolution 515 earlier this year, urging U.S. Congress to pass that bill, the SSI Savings Penalty Elimination Act, to increase resource limits for such supplemental security income to help those folks that would be impacted. We do have a part 2 question.
Well, there's a...
On this, oh,
Yes. Okay.
Hi, I am Carolyn McGroody Durstein. I'm the parent of a child that is hearing impaired, and my oldest child has auditory processing disorder. So my child is in a gray area that legislatively has numerous loopholes that inhibits him from accessing resources to support need. And so while my child has been able to access resources because of my advocacy, this is a hearing impairment that impacts, given the Cleveland Clinic, up to 70% of Americans over the course of their lifetime. So is there any understanding or push to better support auditory processing disorder, neurological hearing loss, and how that impairs people's lives to ensure access to hearing aids and other resources? Any knowledge around that? Or could I just talk about it and make you guys start thinking about it?
I have a bill that addresses the availability of hearing aids on and getting that covered by insurance. It's not going to be passed this session, but we do have a commitment from a committee chair that they are willing to have it get through committee next session, and I'm sponsoring that with Representative Hanbidge. Now, that is exclusively addressing hearing aids and their availability through insurance. On some of the other issues that you raised, I don't know enough to be able to do that, and I would follow up with you, but if anyone does have any knowledge of how any of those things are being handled.
So moving forward with that legislation, if you could make sure that it includes language to include auditory processing disorder, because it's a loophole right now that is a barrier for folks with auditory processing. Much of the legislation currently impacts people with ear level impairments, whereas my children's level of impairment is neurologic, and so they are not qualifying for resources. They have because of my advocacy, but it leaves a tremendous amount of American children and people without access.
We can talk with you right after we're done.
Thank you.
okay. How are you working to secure funding for public transportation, given that fare hikes and outdated infrastructure affect the disability community disproportionately?
Am I going to take that? All right. I don't have it on today, but I've got my SEPTA token But I've been a real strong advocate for, and along with a group called Transit for All, PA. And transit right now is predominantly a state issue. There are a lot of federal funds that are available, thank you for that, in the Infrastructure Act, but they require matches that right now the state of Pennsylvania has not been ready to provide. So we're negotiating that larger deal for transit as part of a transportation funding package that we hope will come before the end of this session. We don't have much time. We have about 3 or 4 days, but we are working on that. With respect to how that connects up with the disability community, we have been working with our transit partners to make certain that they are paying attention, and that when they get this funding, they will be using their resources in a better way to effectively make SEPTA, which is our mass transit, accessible. And we do have one of the folks who's attending today who does work in compliance with SEPTA. And I think one of the things that this brings out also that I think is important for folks to recognize is the difference between official legal compliance with the Americans with Disabilities Act and real accessibility. We passed the ADA, or the country passed the ADA back in 1990 at a time when the concepts about how and in what way people with disabilities were going to become full partners and full citizens was different than what we are holding ourselves up to today. So it is time, I think, for a reboot, an ADA 2.0, if you will, but we're also having conversations about how outside of the legislative realm we can create true and complete accessibility, and to do that in ways where things are subject to universal design, so that the accessibility that people experience is more natural and free-flowing and simply a part of the fabric of our society. And that's another thing that has to be done in the transit system as well. Yes.
And just to piggyback on what Representative Hohenstein said, our office on the local level is actually working with CCT, which is our paratransit in Philadelphia, to find out ways or possible solutions of locating CCT. So for example, when we have residents come down to the City Hall area, it's very difficult, as you can imagine, around the Circle, JFK Boulevard, Dilworth Park. It's very difficult for residents to find the transportation when they're ready to leave, for example. So we are working on something right now. I can't go into detail because it's still in the planning process, but I just wanted to piggyback on that as far as transportation on the local level.
I can add to that as well that the United States Department of Transportation highly values the dignity of people with disabilities while traveling, and there is a lot that is going to be coming out, including acts focusing on wheelchair access. And that also ties back to the 504 Rehab Act that virtually has been untouched since 1973. And finally, there is increased focus on updating it, and we are seeing a lot of strong comments. We've seen that up through October 4th when we were open to comments, and we also see the Department of Transportation looking to that as well. I do say that you should continue to look forward to seeing what the changes are after all of the public comments have been reviewed, and please continue to share your feedback to anything that is related to any federal agency in that work. I want you to know if you do share a comment, every comment is being read and acknowledged, so share your feedback at any point with the U.S. Department of Transportation, with Health and Human Services, or any other federal agency. There is more change happening because of your comments and because of your advocacy.
Hi, hello. Yes, my name is Joshua Beekman. I wanted to talk about the SEPTA issue real quick. Like, for example, here, this is, there's a SEPTA table here at this disability event. I do understand to fill out and get a disability card, a reduced price for a reduced fare, the form itself requires a doctor physically to sign that paperwork. And I do understand in general, people typically will go and get that done, but I'm thinking for this kind of event, I mean, do I have to get that from a physician to come to this event? We have people with various disabilities here. I have to get, I need the discount now so I can get on the spot, so I can get here. So I think in general, Americans are having, you know, and when you're hosting events, we should have like a different kind of form for some quick event that we need to get to. Just some feedback, I would say something like, it'd be nice to have something like ability to compensate and be able to get some accommodation quickly if I need to get someone fast and use the transit for that. Now, speaking again of Philadelphia, there are a lot of deaf people that live here. We work at Pennsylvania School for the Deaf, for example. A lot of deaf people have a variety of different needs and abilities, but when we're focusing on, not only on deaf people, but also how can we improve the experience for people all around and the benefits for people all around related to like when you make announcements, having captions, having visual support for those kinds of things in accessible places. There are a lot of things that we need to work on. They have captions today, for example, in a restaurant, in a sporting event. The captions may be very, very limited for what you can see, but ironically, but in like sporting events that are very loud and noisy, how are the people actually understanding anything that's happening on the television that they're watching? The irony is there, and I don't quite understand if people are comprehending anything. The caption provides that support for everyone, and we need that for everyone, not just deaf people, but hearing people as well. Thank you.
Thank you for that comment, Joshua. I just want to say in relation to that, my office, the Office for People with Disabilities, has been working with the Special Events Committee for planning and development of citywide events. And we've been working in collaboration with them for the past year or two. And so having us at the table ensures that they are including people with disabilities, whether that's having an interpreter for an event, having cart services, if there are Jumbotron screens, we are communicating with them to ensure that they have as much accessibility as possible, and that includes physically as well for pathways or walkways, as well as seating. So I just wanted to, you know, make that known. We were not at the table before that, but that's another job of our office. We have been inserting ourselves, whether we're welcomed or not, to ensure that our city is more accessible. And on that note, we also were very involved in bringing FIFA to the city. I was on the board to work towards that end. And so one of the features that we were able to communicate with the bidding process was that we are a more accessible city. We still have a long way to go, but we have made a lot of improvements.
Yeah. I'm also going to say thank you for that. I'm also going to note the irony that I'm a hard of hearing person who often uses captioning, and I was having to struggle because I wasn't able to see the closed captioning of your comments because the screens aren't set up that way. But, and I think that also points out, one of the things that I know about the disability community is its ability to give grace when we don't do the job that we're supposed to do. But there's a difference between giving grace when people are making efforts and don't quite meet where we need to make, and what we often see in our governmental and societal structures where people aren't even giving the efforts at all. And I think that's where we need to insist on doing better. Your proposals for providing greater access in captioning and in other spaces, and your point that this is not simply a service for one disability community or even the disability community as a whole, but rather for society as a whole, is extremely well taken. And that's something that I applaud you for.
Thanks, everybody. My name's Alex. I work at the welfare office. I'm on medical leave, though, because I was hit by a car on August 1st. I fill out people's applications for food stamps and Medicaid, but this time I had to fill out my own application for an in-home and community-based service waiver. And I had my person come and do the in-home visit, and I learned the reason why they do the first in-home visit is to make sure that the patient who is applying for the benefit lives in adequate housing and is adequately sheltered, because if they don't, they could be denied the benefit, if they're, from my understanding, is what they told me. And so as someone who is housing insecure now because of my disability, being on medical leave, I was wondering what options that there could be done at the state, the federal, and municipal level for addressing homelessness for people with disabilities and ending it, and also ending housing insecurity for people with disabilities. From my understanding, is housing is one of the top issues that people with disabilities vote on. Thank you.
Hello, thank you so much for your question. And I'll answer that from the federal, but also kind of big picture perspective, and then hope for some state-based comments. As I mentioned earlier, Senator Casey has been doing some work around accessible housing, but also housing that's affordable. And we know that most people who receive Medicaid benefits, for example, are not able to pay rent in any housing market in the US. And affordability then becomes just as important as accessibility. And so part of the question, which is sort of a chicken or an egg, is, you know, how do we get at both issues and also make sure that we're continuing to invest in building new stock housing, because we know that what exists isn't enough, and it also isn't useful, to say it that way. So we've actually heard from constituents in Pennsylvania who had similar situations to you. We had one constituent actually testify in front of the Senate Aging Committee on her issues around homelessness, and how her aide couldn't come to the shelter when she experienced homelessness, and the fight that she had to put up through her own self-advocacy, but only through her network and connections to be able to actualize a better living circumstance for her, and it shouldn't be that way. So on the front of creating more affordable housing, Senator Casey is very committed to making sure that Pennsylvania gets those funds and has requirements to build more housing. On the side of services and supports, I know that CILS usually can be a place where the Centers for Independent Living, where resources can be found, but also there is some new regulation and programs coming out of HUD, the Housing Urban Development branch, to make sure that there's more flexibility in terms of rental assistance for people on waiting lists. So there is a lot being done, and I'll pass it to my kind of state folks here, but it's a very important question, and I appreciate it.
Yes, thank you for your question. So I just want to say that this is where my architecture hat comes into play with universal design. Philadelphia has 17% of its residents with disabilities. That is the highest amongst large cities in the United States. So as you can imagine, housing is one of the questions that my office gets very often. And unfortunately, we do not personally, from our office, have homes or housing stock that we can refer folks to, but we do have a lot of other organizations that we work with, such as Liberty Resources, for example, and so we refer folks there. But universal design is something that really needs to happen more often. It's something that my office has discussed quite often recently. We're talking about possible policy change that we can initiate, perhaps on the city level, local level, to encourage builders to build more accessible housing in the city. And so this is a very, very important topic. And the topic that you also mentioned about shelters and nurse aides or assistance to those who need it is also a very big topic. And my office has also been working with the Office of Homeless Services for the city. We just gave ADA training to their staff this past summer. And training is something that we do quite often for other city departments, private entities, as well as internal departments as well, on what the ADA is, why it's important, and what you can do to advocate for people with disabilities. So we wear a lot of different hats, but it is definitely on our radar. Although we mostly handle Title II of the ADA, we are also branching out to some other issues that are of main concern in the city.
I'm just going to add that I think when you look at the map that that the Office of Disabilities has, and there's an ability to do some overlays. And one of the most important overlays is where is our disability community and where are the communities that live in poverty. And that's why these two questions of accessibility and affordability have to be answered together. And I think the most effective way will be insisting on a seat at the table, a place in the room where the decision making is being made, so that this, policies like universal design can be put out there, and also that the needs of the disability community are always front and center, and then again having that being done by people who understand that there is also this connection to poverty, and so that affordability has to be a piece of it at the same time. And so I think my proposal for solutions would be making sure that there's a seat at the table for the disability community in order to be able to communicate both of those issues together.
Hi there, my name is Sandy Sharina, and I have a question about the recent hurricanes and any preparation that the city and state are doing for any major event that happens here, and how the people with disabilities are being taken care of in that situation, and how their people with mobility issues, how they are being managed and to get them to safety, and to be able to communicate with them also.
So we are going to have later this afternoon, there is a 2 o'clock breakout session being given by Philadelphia 250 on some of those issues. And in our legislative policy hearing, our final hearing, will have a presentation by one of the board members from Philadelphia 250, Tom Earl from Liberty Resources, and I'm forgetting the, Mike Bovino from Special Olympics to talk about some of the different special events that are coming in and how we're connecting the disability community into them and how the city is preparing for them as well. I don't know if you have any other additional things to add to that. Tawny?
I can add to that as well. It's important to know that FEMA has been paying a lot of attention specifically to what you are talking about. People with disabilities cannot be ignored or abandoned, especially in times of national disasters. That is a violation of human rights. It is important that that is adequately addressed. FEMA has pulled together several teams to work with community members and develop specific resources for disability communities. They've created some model toolkits that cities and states can use and adopt in times of crisis. This includes for folks with mobility disabilities, those who are deaf or hard of hearing or blind. They have other toolkits together as well, and FEMA will continue to do this work and certainly continue to collect more input from people with disabilities themselves who have experienced the last 2 hurricanes, for example, only in the last few weeks. I've been able to talk with some great FEMA folks in this state, and we see that there is a lot of excitement about and enthusiasm around making sure that information and resources are provided for people with disabilities through this year and in further years. So keep an eye out for that information.
All right. I think we're getting close to the end. I want to just, I'm sorry. Yep.
And I just wanted to add that my office has also been working with the Office of Emergency Management to ensure that they are providing accessible communication methods in case of an emergency in the city.
Yeah. And on that note, I also want to really give a shout out to everybody who came from Washington, D.C. as part of the team from the White House. A number of you have been working on the emergency issues that are being dealt with by the disability community in the wake of Helene and Milton, and they're juggling those responsibilities along with coming here to our little gathering. So I want to shout out that to the White House staffers who have been coming up and being a part of that. We're going to get ready to close out tonight, right now, but what I want to do just before, as we are finishing, is give a final pitch to make sure people are registered to vote. We have the city commissioners here. We have the Department of State here who can make sure that today people are getting the access to register. And in Philadelphia in particular, all the way up until October 21st, which is the registration deadline, there are effectively early voting centers where someone can go in, register to vote, request a mail-in ballot, receive that mail-in ballot, and then fill it out, complete it, and basically hand in their vote right there that day with a city government official who will take their vote. And that whole process, I did it. It took 20 minutes. I didn't have to do the registration process, but I did the mail-in vote all the way through to getting my ballot back, filling it out, and casting it in less than 20 minutes down at City Hall. And there are those types of centers all throughout the city. You can find out those locations, again, from the City Commissioners table and also the Department of State table. And the Department of State will have an instructional webinar about how to handle a number of the different factors and details and obstacles that come up by people from the disability community who are casting their vote, including designating an individual person if you yourself cannot take your ballot to the mail or to a drop box location, but need assistance in doing that. There are forms for that. We have those forms here. So with that, I'm going to get off my soapbox, and I think we're all going to get to lunch. And again, we will have some conversations afterwards. And Allison, sure.
I don't want to keep folks away from lunch, but I did, was remiss to mention one thing. We are celebrating this December the 10th year anniversary of ABLE, of the passage of the original ABLE bill, which is a huge accomplishment. And since then, Senator Casey has also worked on initiatives to build on ABLE. So increasing the age that people can apply and have these accounts. Also a matching program to ensure that people with lower income can save, as well as a more of a marketing campaign to ensure that people receiving certain federal benefits know about ABLE accounts. Pennsylvania was the first actual place to open ABLE accounts and is an example to lead in our country around having access to these types of savings. But I just want to remind everyone that there's more to do in this space, and not to forget that in December we are celebrating 10 years of that, the passage of that law. Thank you.
Thank you very much.
Thank you. It's a pleasure.
Sorry about that.
Oh, that's okay.
No, it was a good idea. It was a good idea.
And what I do like is when you